Today topic is medication policy. What is medication? A medicine is a substance that is taken into or placed on the body that does one of the following things. Most medications are used to cure a disease condition. For example, antibiotics are given to cure an infection. Medications are also given to treat a medical conditions. For an example, antidepressants are given to treat a depression. And also medications are given to relieve symptoms of an illness. For example, pain relief. So, and also medicines are given to prevent disease. For example, the flu vaccines helps to prevent the person from complications of having a flu. Today mainly we are going to discuss on prescription policy, dispensing and administration policy, verbal order and high-risk medication policy, LASA policy, medication storage policy, narcotic policy, near expiry and expiry medication policy, finally adverse drug reaction. So these are all the main important topic in a medication policy. So in the sense, what is prescription policy? So prescription of a medication policy, it includes all order for medication shall be written, records of the patient and shall be in appropriate location. These orders shall be cross-checked by treating consultant and shall be signed, named, time and dated. So all the prescriptions should be recorded in a medication checklist and the name and sign of the doctor should be present for all the prescription. And prescription shall be written and signed by treating doctor and shall be clear. The prescription should be always, it should be in a clear, legible, dated, timed and signed. Okay, so these many content of a prescription. So the prescription should be legible and it should be in a clear, and also it should have a date and sign and name of the doctor. And also special care shall be taken while prescribing high risk medications. Finally, the prescription should have registration number of the prescribing consultant. So this is the proper prescription policy. So always the prescription should be clear, legible, dated, timed and name of the doctor. Finally, it should get end with the registration number of the consultants. So this is prescription policy. Once it is legible, everything it includes, then the pharmacist can issue the medicine. Next is dispensing policy. So what is the dispensing policy? Here the pharmacists are very responsible while dispensing of medications. Always whenever they get proper prescription, they are supposed to check the right prescription as explained above before dispensing the medicines from the pharmacy. And also they supposed to check the right medications for integrity of the medications. So before dispensing, they should check the right medication as well as integrity of the medication. And also they supposed to check label of the medication and name of the medication, dose, batch number and expiry. And also if high risk medication if they are issuing, they should double verify the medicines. At least 2 pharmacies should double verify the medication. And also no medications will be dispensed without prescription. So always the prescription should be there to dispense any kind of medications. And also all Schedule X and Schedule H drug should be, the prescription should be stored for the 2 years, especially for OPD patients. Next is medication administration policy. Here the nurse's role is very very important. While administering a medication, they are supposed to follow proper protocol. So what are all the protocol for administration of the medication? In the sense, they are supposed to have a right prescription from the physician before administering of any medication. And also always the registered nurse or licensed practitioners is approved to administer medication as to the patient ordered by the physician. So those who are administering the medication, they should have a registered nurse or licensed nurse. And also they are supposed to verify before the medication administration. There are treatment orders, general appearance of the medication. They look for the medication, and also they should check for the medication name, dose and frequency and time of the medication. And also she is supposed to check for the 10 rights of a medications. If they follow 10 rights, definitely they can prevent a medication error. So what are all the 10 rights? There are right patient, right drug, right dose, right time, right route, right documentation, right history and assessment, right to refuse, right drug interaction and evaluation, right education and information. So these are all the 10 rights. So this has to be followed whenever they are administering the medications. This is regarding medication administration policy. Next is verbal order policy. So what is verbal order in the sense? In case of emergency situation, doctor gives an verbal order or telephonic order regarding medications to be administered to the particular patients. So these verbal orders should not be taken routinely. It will be used only during emergency situation. And the individual accepting the verbal order shall record and then read back the order. So always whenever you take a verbal order from the doctor, you should repeat back the order. So entirely to the prescribing doctor at the time of the order is given. Document that the order was read back. So always whenever you read back, same thing should be documented. And the nursing staff shall tag all the verbal order with a sign year and date. So whenever you receive a verbal order, there should be a one column because that has to be signed by the given consultant. So always you should put a sign year and date. The tag should be attached. And also nursing staffs are permitted to act upon verbal orders provided the order contain the appropriate information. And also verbal and telephonic order shall be signed by the prescribing practitioner as soon as possible, not later than 24 hours. So the verbal order should be signed by the prescribing doctor within 24 hours of order. When the order doctor is unavailable, it is acceptable for another team member or the attending doctor to authenticate the verbal order. So compulsory this must be documented. So this is regarding a verbal order policy. The verbal order will be given during only in a emergency situation, and the nurse who received the verbal order, she is supposed to read back the verbal order, and also the authentication has to be done by the doctor within 24 hours of verbal order. This is regarding verbal order policy. Next policy is high-risk medication. High-risk medications are drugs that bear a heightened risk of causing significant patient harm when they are used in a error. If you does any error during administration or issuing of a medication, definitely it will heighten the risk to the patient. And special care shall be taken handling these medications. These shall be made available only on provision of written prescription. Without written prescription, these high-risk medicines should not be issued. Order of the qualified doctor. So always these high-risk medications should be ordered by the qualified doctor. The drug dose, route, time and frequency of administration shall be double checked before administration of the drug. So any high-risk medication before administration, 2 nurses verification should be done. And also these drugs shall be administered only by qualified nurse or doctor. Self-medication shall not be allowed for these drugs. So always these high-risk medications, preferably senior nurse or qualified nurse supposed to administer. These drugs shall always be kept under lock and key. So all these high risk drugs should be stored under lock. Patient shall be monitored after administration of these medications for any sign of adverse reaction. So after administration, staff responsibility is to monitoring of our patients, because since it is a high risk medication, so it will heighten the risk. In that case, after administration, the staff supposed to monitor for the any adverse drug reaction from the high risk medications. So this is regarding high risk medication. You can see the list of high risk medication. So what are all the risk of high risk medications in the sense? A stand for anti-infective drugs, P stand for potassium, I stand for insulin, N stand for narcotics, C stand for chemotherapeutic agents, H stand for heparin. So these are all the main high risk medication list. And next policy is lookalike and soundlike medication policy. Again here also we can expect many time medication error. In that case, proper lookalike and soundlike medication policy has to be followed. Lookalike soundlike medications involve medications that are visually are similar in physical appearance, or packing and names of a medication that have spelling similarity and are similar pronunciation. So it looks physically, when you see it looks same, and also whenever you are hearing it looks similar. So this is look-alike and sound-alike drug. Avoid storing look-alike and sound-alike in a same place. So always better to store in a different shelf, and also give a color coding for the look-alike and sound-alike drugs, like a looking similar drugs green color, sounding similar drug can give a pink color. And also like example for a look-alike, tropine and pyrrolate, and for a sound-alike, drotin and dita. So drotin and dita, it similar pronunciation, and tropine and pyrrolate, it looks physically same. In that case, definitely medications error will happen. So always store it in a different places so that it will prevent a medication error. And whenever giving a orders, proper communication, it should be in a clear manner, so that staff can get a proper communication and can prevent medication error. And always identify medicines based on its name and strength, and not by the appearance or location. Read medicines label carefully at the dispensing stages and perform triangle check. Triangle check is to check actual medicine against the medicine's label and against the prescription. Double checking should be conducted during the dispensing and supply process. So this is regarding a look-alike and sound-alike drug policy. Next policy is medication storage policy. So always the medication should be stored in a proper manner, so then only we can get a proper efficacy from the medications. So in that case, what is the medication storage policy? Medication shall be stored in a clean, well-lit and ventilated environment. Medication shall be protected from loss and theft. Medication shall be stored as per the storage requirement specified by the manufacturers. These should be address issuing pertaining to temperature, refrigerator, light, ventilation. So always the medicine should be stored in a clean place, and also proper temperature as per the manufacturer. We should maintain a proper temperature for the medications. Preventing entry of pest, rodent and vermin in a pharmacy. So always pest controlling supposed to be done in a pharmacy to prevent pest. The storage of medication is done in the alphabetical order of their brand names in all the area. Arrangement is made in such a way that the near expiry is first out by placing the new stock behind old batch, as the new stock normally possesses longer shelf life. So always whenever you are storing, first in first out policy has to be followed. And also refrigerator storage and room temperature shall be recorded once in a day. So the proper recording of a temperature of room and refrigerator must be conducted in a pharmacy at least once a day. Medicines that are required to be stored between 2 to 8 degree are kept in the refrigerator. The high-risk medicines, when stocked in pharmacy, shall be labeled with a red color sticker stating high risk for identification. High alert medications are kept separately for limited access in the ward and ICU. Store narcotic drugs under double lock. Lassa medication must be identified with a color code and stored in a different track. So this is regarding a storage policy. The medicine should be stored in a clean and well lit ventilated environment, and also should be avoided pest entering into the pharmacy, and also the recommended temperature must be maintained for the medication, and also different arrangement has to be done for the high risk lookalike narcotic medications. High risk medication should be in a single lock and narcotic medication should be in a double lock, and also color coding for a lookalike soundlike drugs and high risk medications again for a easy identification. So this is regarding a storage policy. Next is narcotic policy. All narcotic drugs shall be kept in a double lock and key under the supervision of a nominated person. All transaction records shall be maintained for 2 years. Proper documentation shall be there for a order of narcotic drug use. Patient specific drug administration consumption record shall be maintained for 2 years. Hospital shall have a license for the procurement and uses and control of drugs. Information about losses, theft shall be given to local police station and excise inspector. Breakage, expiry should are informed to excise inspector immediately for record. Transportation of a narcotic drug from the vendor should be done through the well covered four-wheeler vehicle. Proper prescription from an authorized doctor and proper documentation must be maintained. If any unused narcotic drug must be discarded in front of 3 witnesses, example anesthetic, in charge and senior nurse. So this is regarding a narcotic policy. Always the narcotics should be kept under double lock. Next, near expiry and expiry drug policy. Staff responsibility to check every month near expiry medicines in their stock, identify and segregate medicines which is nearing to 90 days and send the medicines to pharmacy. Receive the fresh batch medication from the pharmacy and store in a stock. Pharmacy staff also check the near expiry in their stock, identify and segregate it in a separately. All near expiry medicines must be returned to vendor through pharmacy and receive fresh stock to pharmacy. Expiry medicines are identified and disposed as per biomedical waste policy. So this is regarding near expiry and expiry medication policy. Next is adverse drug reaction and event. ADR in the sense a response to a drug which is noxious and unintended and which occurs at dose normally used in a man for prophylaxis, diagnosis or therapy or disease or for the modification of physiologic function. Adverse drug event. Adverse drug event are any untoward medical occurrence that may present during treatment with a pharmaceutical product but which does not necessarily have a causal relationship with this treatment. How do you manage the ADR and ADE? Management of suspected ADR in the sense type A reactions, reduce the dose or withdraw of the medication, Type B, immediate withdrawal of the drug is first step if the reaction is mild. No further intervention are needed. Anaphylaxis reaction. Immediately medical emergency has to be activated. A senior help should be summoned, including anesthetist. Position the patient flat, feet raised, airway secured. Administer oxygen, give adrenaline, follow the doctor orders. Further deterioration may necessitate IV fluid, nebulizer, inhaler, intubation or tracheostomy. So these must be conducted whenever the adverse drug reaction happen, and immediately the action must be conducted, and also ADR form has to be raised by the responsible person.